We are so excited today on the Prednisone Warriors with Dr. Megan YouTube that we get to hear from a fellow YouTuber who takes prednisone. We have Caitlin, the super loopy. She is going to tell all about herself in just a moment, but she's probably been on prednisone way more than I ever have. So this is going to be a wonderful experience finding out how it feels to start prednisone when you're younger and then find out what she does to cope because she's got a long history of it. All right, tell us, Caitlin, all about you and your prednisone story.
Sure. So nice to meet you guys. I'm Caitlin, aka Super Loopy Woman here on YouTube. And yes, I have been on prednisone for a while, varying doses. So just to tell you a little bit about how I started on prednisone, whenever I was 12, I was diagnosed with systemic lupus. And they had to put me on prednisone right away just because of the severity of my symptoms and how quickly they were onset. And it did help, which is great. However, being that I was 12, I didn't stay on it initially very long. I did end up getting off of it just because when you're a teenager, you're preteen, you're vain, you don't want that weight gain. You don't want that acne, the profusive sweating. You don't want those things. And it's sad, but whenever you're in the middle school, those things are more important to you than your health. So I didn't stay on it very long, maybe like a year or two, which I guess is kind of long for prednisone. But so I refused to be on it all throughout high school and my young adult years until I had no choice. I had to get back on it. It was actually so bad that I was begging them to put me on it. So what happened is I've always struggled with, pain and inflammation that just comes with the lupus. There's this one day where I couldn't walk. So I took a girls' trip with some of my friends, and the trip was awesome. Loved it, every second of it. My husband set it up for me. And everything was fine until the flight back I'm here in Pittsburgh. And I noticed like more and more intense pain in my hips and my legs while on the plane. And when we got off of the plane, I couldn't walk. It was a struggle. It was very difficult for me trying to kind of hobble my way through the airport just to get my bags and get home. And I'm better about it now, but that kind of thing was embarrassing for me, just because my friends weren't really helping. They weren't like encouraging, and it's scary. I would have had to have been maybe 23 or 24 years old and to just suddenly not be able to walk. It's scary. So I had to take a few days off of work. Just couldn't move. And then I called my doctor and begged and begged and begged, because prednisone, it helped. It helped with the inflammation and it helped with the pain significantly. But then when you're not on it for so long, you realize, oh yeah, that's why I didn't want to take it, because of all the side effects, and there are so many. Long story short, I've been taking it pretty much ever since. The highest dose I've probably been on was maybe like 30 to 40 milligrams a day. The lowest I've been is 2.5 milligrams. I can't seem to go below that. So, and then currently right now, I am on just 5 milligrams a day, which is a huge accomplishment for me. I'm proud of it.
That is a huge accomplishment. 5 milligrams. Like, to me, 5 milligrams, it's like, okay, like I can tolerate this. 5's
Yeah.
okay. Like the price, that's a price I'm willing to pay, essentially.
Yeah.
For me.
Yeah. It's not so bad. It's just enough to help so I can function as a normal human being.
Exactly.
But
oh man. So that's quite a story to beg to get on prednisone. I can
yeah,
only imagine how bad it must have been. If
I mean, it was so bad that I was begging them for the steroid injections and the oral prednisone, just because it's insane how well my body reacts to prednisone. It's crazy because it like if I drop below 2.5, even if I drop below 5, really, I notice a huge difference. And it's like this crazy drug, and it gives me energy and moon face and less pain. So I'll take the energy and the slightly less pain for sure.
yeah, definitely. Oh man. So for fellow people with lupus, they know what we're talking about, but I think there's a huge gap in understanding of what in the world you're talking about. Like, why wouldn't you be able to walk? Why would you have pain? Why any of those things? Like, what is lupus? What are
Sure.
And how did you get it so young?
It's a very good question.
Questions people are wondering right now.
Yeah, very, very good question. So what is lupus? It's an autoimmune disease. So basically my immune system attacks itself. It attacks healthy tissues, healthy organs. So what I like to tell people is think of how your body would attack a flu. So if you were to get a flu, naturally you get a fever, you have aches, pains, chills. Sometimes you can get rashes. There's a ton of different things to lupus. It's a very complex disease because it can affect any organ at any time. For instance, one of the main symptoms is the usual telltale sign is you get a rash right here. And they call it the butterfly rash. And that's a lot of times people's first, like, hey, you have lupus, that kind of thing. But it causes hair loss, muscle aches, joint pain, lots of inflammation, fevers, you name it, it's probably a symptom. So, and to answer your question about how I got diagnosed so young. So for my family, we do have people in my family who have lupus, and they say it can be genetic, or that it is genetic. So that was kind of like our first red flag. And being 12 years old, it was time to go through some changes to be a woman. And lupus is very hormonal. So hormones just really amplify all of the symptoms. So, it was that point in my life. So that was a second red flag. And also at the time, my mom and stepfather had been going through a divorce and we were moving. So I had lots of stress, and that right there, the stress and hormones, that really, really amplifies it. So anytime I'm having like a difficult period with depression or anxiety or stress, anywhere in my life, it really amplifies my symptoms. So with the genetics and the hormones and the stress, it was pretty easy for them to tell, unfortunately, which is interesting because I have to say that most people, to get their diagnosis with lupus, it can take years and years and years. So they were able to pinpoint that for me pretty quickly.
Yeah, that's amazing that they found it so quickly, because a lot of those symptoms are really non-specific. Like, it's really hard to be like, oh, that's lupus. It's like,
yeah,
that's Like, why are you having the joint pains? Why are you having the fevers? Like, diving deeper into each of those symptoms might take years. I can definitely see that.
Yeah, it just seemed that with everything going on in my life at that point, it was enough to super amplify my symptoms. So I had been to the emergency room for migraines, just pain, um, allergic reactions they thought that I was having because I had lesions all over my body. But in the end, we found out that that was all lupus related.
Wow.
Yeah.
So you were unique being diagnosed so young. What would you say is the typical age that people get diagnosed?
I would definitely say it's more common in women by far. And I would have to say women in their childbearing years. So I would say most people that I've met that I know personally have been diagnosed somewhere between the ages of, let's say, 18 and 30. So it's like you get to enjoy your kiddo years, and then it's no more fun and game.
Oh man. And so you're not the only person with lupus who's had to take prednisone. And so what would you say, in your experience and having talked to other people with lupus, are the typical doses that they might give somebody? Like if somebody's brand newly diagnosed with lupus and they're like, you're going to get prednisone, what could they expect is like a normal?
Sure. So what I've noticed in my experience and with my friends who have lupus, I find that they typically really like to start you off pretty high and then kind of work you down. So I wouldn't say that there's a typical dose. Everybody's a little bit different, but I from my personal experience, they usually like to start you off between 20 and 40 milligrams a day, case by case, depending, of course. And the maintenance dose, I would say, like once they kind of get you over that hump of your symptoms, the maintenance dose is typically around 5 to 10 milligrams, maybe, just depending on what's going on with that particular person.
That makes sense. Yeah, that's what I've observed in talking to lots of people who are on prednisone and might have be like taking it for lupus. So, would you say most people with lupus take prednisone, or would you say only some people? Like, you're probably in support groups and stuff and know what's going on.
Yes. So I would say that most of my circle of lupus warriors is on prednisone. And then I would say 9 out of 10 have been on it at some point. Maybe not actively taking it, but I would say 9 out of 10 of my fellow lupus warriors have taken it at some point.
So if they're not taking prednisone, what other medicines might they be using? Like, what else do you use, and what else do other lupus warriors use?
Sure. So with lupus, there's a lot of different drugs that they use to treat, mostly just treat the symptoms. So other than prednisone, NSAIDs or non-steroidal anti-inflammatory drugs, those are pretty popular. Sometimes they'll just start you off with like ibuprofen or Motrin. And then once they see how things are progressing, they'll like to do drugs similar to like meloxicam. They like Celebrex, diclofenac, things like that. I'll probably have to take for the rest of my life just to help manage the pain and inflammation. With lupus as well, one of the big drugs that is pretty common is called Plaquenil. So that's a very important one. To be honest with you, I don't really understand how it works, but I've been on it since I was 12. And I know everybody in my group kind of got really scared because with COVID, they were originally saying like Plaquenil, it's miracle, it's going to help. But I've noticed that there's a lot of just in general shortages with it. So like that boom, like maybe March or April of last year, it really scared some of us. We were worried we weren't going to get our medicine. Other than that, I would say those are like the main medications. They could put you on lots of other things too. Like I am on like 15 different medicines, but I would say those are the most typical drugs to treat lupus, aside from Benlysta, which is the first drug to treat lupus, I think in like 50 years that they've made. So that was a pretty big breakthrough.
Are you on Benlysta?
I am not currently on Benlysta. I look forward to trying it in the future. But right now I'm on something kind of similar called Humira.
Humira, cool. Yeah.
And that's a biologic. So a lot of patients with lupus are on biologics of some kind.
Yeah. There are so many of those options too.
Yes.
Humira for sure.
Yes.
Yeah, I remember that hydroxychloroquine time. I was in the news about it because it was so crazy. Like they needed somebody to talk about like who actually uses this drug. And then I mean before there were real like shortages before that. Like the supply chain has never been great for hydroxychloroquine, which is for Plaquenil. So yeah, I hear you. It's been a crazy ride with the COVID. Everybody's trying to steal it. Okay.
We were like, please, no, we need this.
Leave us alone. We've already gone through roller coasters.
But I have to say that if you have a good pharmacist who, I mean, you see them to get your medicine filled all the time, they were definitely thinking about you during that period. They definitely knew like, okay, Caitlin takes this daily. Let's make sure we have some for Caitlin. So if you had a rock star of a pharmacist, then you were pretty much good.
Exactly. They were, at least the pharmacists I know, they were all like, I have these patients who need it every day. Let's leave it alone for them. And if we can get more, great. But otherwise, like they need it and I'm representing them.
Mm-hmm. And that's what makes a great pharmacist.
They have a legitimate 100% need for that. Okay, so what would you tell others who are taking prednisone to expect based on all your experience?
Well, I'm not going to sugarcoat it. I'm going to be honest.
Let's be honest.
It's a super love-hate relationship. There are probably going to be points in your treatment where you're going to beg for a higher dose or beg to be on it. And then there's definitely going to be points in your treatment where you're like, why am I taking this? I don't understand. It's just the fact that it has so many positives, but also so many cons is the side effects. There are so many side effects. It's crazy. The ones that affect me the most are insomnia, night sweats. That's terrible. Terrible. Sometimes I have to take like 2 showers a day just because I'm sweating profusely, and that's all the prednisone. It's unfortunate, but and I've noticed that it causes me some depression, definitely weight gain. My face is a little puffy. It's not as bad as it was, but since I'm going down lower in dose, but that can make you really self-conscious. Luckily, I was on a higher dose when there's the pandemic and I get to wear a mask to cover my 8 chins. But yeah, I've definitely, the side effects are rough, but in my opinion, it could be worth it for you for sure. If you're in pain and you can't function, sometimes you just have to. I remember my husband and I got married this summer, and I stopped taking the prednisone because I was like, I need to be thin. I need to look great in my wedding pictures. So then I wasn't feeling good. I wasn't feeling awesome. And yeah, it's a check and balance drug. I don't know how else to describe it, but yeah, so it's like, well, I don't know. Did I make the wrong decision by stopping it? Probably, yeah. But yeah, so yeah, the shaking, the insomnia, the depression, the night sweats, the bruising, the bone loss, weird lab results whenever I get blood work done. That's really difficult. And if I may, I'll say the most scary thing that happened to me while on steroids. I've been having really, really bad hip pain and begging my doctors to take x-rays. Everything looks normal. Everything's great. Until I'm like, no, there's something wrong here. And I used my voice to convince my doctor to order an MRI. And I was terrified of osteonecrosis or something like that, just terrified. And it turns out that there is something wrong with my hip, but it is not prednisone related, thank goodness. But yeah, sometimes you just have to use your voice and fight for yourself. But those kind of things are what you think of whenever you're on prednisone is, oh my gosh, bone loss. Oh my gosh, osteonecrosis. Like,
I hear you. I did the exact same thing. I was having hip pain and I've been on such high doses. It's like, oh my gosh, I'm pretty sure I have osteonecrosis. And
I was like, this is it. This is it. I need a walker now.
Walker, hip replacement, the whole, I'm going to need it all. Yeah, for sure. And thankfully, I had no problems either. But
good.
It's scary. I mean, it's really scary that you never know when you're the one who is going to need a hip replacement because you took prednisone.
Yeah.
Like
someone's got to be a part of the statistic.
Yeah. Like I feel like I'm always like the one. Like, oh, it's 1 in 100 chance. Me. It
was me.
I got that one.
I have an ongoing joke, I guess. It's that my life is a series of unfortunate events, and anything that can go wrong will certainly go wrong. But at least I have a good attitude about it.
And a beautiful smile to go along with that.
Well, thank you.
Even if it's going wrong, you're smiling through it. So that's what matters. Well, this has been awesome. So this is the question I always ask if somebody's taken prednisone is, what is your go-to snack when you have the prednisone munchies? What do you do?
I would have to say, when I'm on prednisone, I am a sucker for Mexican food. Give me the burrito and the chips and salsa and the guac, and I will be in my glory. It's probably not a great idea because of all the salt in that stuff. It's just going to make my swelling worse. But yeah, I don't know what it is, but I just have to have Mexican food.
That's awesome. I pretty much am like that all the time. So I'm glad that just prednisone. I haven't actually heard anybody say Mexican. That's cool. That's a unique.
Yeah. And then because I'm on the prednisone, I get hangry. So it's like, I need it right now. Or something's going to happen.
Whatever, like it's 1 o'clock in the morning, we're finding the 24-hour Mexican food, right?
Absolutely. Is Taco Bell open? It's 2 a.m. They're open, right?
For people on prednisone, why not? So finally, what is your best advice for people on prednisone?
So my best advice is to invest in cotton and bamboo sheets and clothing, pajamas, because the night sweats, they're gonna get you. I also am totally aware that I get moody, very moody. So I do like warn my husband and warn my colleagues, like, hey, I'm about to go to this dose. Sorry in advance. So that's probably, yeah, I would say the most important is breathable clothing, cotton or bamboo for sure.
That's some good advice, because there's nothing like feeling like you're menopausal when you're only
okay. Listen, I will tell you guys a secret. There have been multiple occasions where I woke up in the middle of the night thinking that I peed myself, but it was just sweat.
It's amazing. Like, it is so bad. I mean, I had like hot flashes. Like, what? I'm 33. How can I possibly be getting hot flashes, right? Like, this makes no
surprise.
sense. No, good luck. Yeah, no. Oh, that's some really good advice. Thank you for sharing that. So I'm sure after watching this, everybody's gonna be like, I want more of this. Where can they find you?
Sure. So I would really appreciate it if you guys would check out my channel. That would mean a lot to me. So I am Super Loopy Woman here on YouTube. I really would appreciate it if you guys would check out some of my content, maybe hit the subscribe button. Totally free for you, but it really helps me out. And the reason I ask people to do that is because I'm sure we all know that YouTube is all algorithm based. So the more people that watch my content, give me a thumbs up, hit that subscribe button, it helps me to reach my goal, which is to reach out to other chronic pain sufferers and just let them know that they're not alone. I've used to feel like that, and that is my goal, is to get the word out there that you're not alone, you're not crazy, and I would really just appreciate it. Yeah, so I'm on YouTube. I'm also on Instagram and Facebook as well. And yeah, I would love it if you'd check me out.
Wonderful. Thank you so much, Caitlin. This has been so informative to help us understand what lupus is, what normal treatments are, and what it really feels like to be on prednisone when you have to take it for lupus. So thank you, and everybody go check out her YouTube channel.
Absolutely. Thank you so much for having me. It's been a pleasure.
Wonderful. Signing off is Dr. Megan, your prednisone pharmacist.